Okay. All right, should we go ahead and get started? So good morning, everyone. My name is Leah Sera. I am an associate professor and vice chair of academic affairs in the Department of Practice Sciences and Health Outcomes Research here at the School of Pharmacy. I'm also an alum of the School of Pharmacy. I graduated in 2010. And an alum of our pain and palliative care residency program. So I'm very homegrown here. It's nice to see you this morning. And I've been working with the teaching certificate program for many, many years. So this is the first of my presentations today is going to be introducing you to both the teaching certificate program and going over the process for signing up for teaching activities independent of the teaching certificate program. So how many of you here have an interest in being a faculty member at a school of pharmacy? A few of you, okay. How many maybe aren't interested in faculty, but want to be a preceptor? Hopefully all of you. Please, all of you say that you want to stay in Maryland and be preceptors. Okay, so a lot of you want to be preceptors. And how many would be very happy if no one ever asked them to teach or give a presentation ever again in their lives? Okay, that's okay. This is a safe space. We can say that here. That'll be the next presentation that we're doing will be all about giving presentations and hopefully addressing any fears or nervousness that you have about that. But the purpose of the teaching certificate program here at the School of Pharmacy is really to prepare residents and fellows who are interested in either a faculty position or some sort of teaching position down the road. And we actually have a couple of tracks within the teaching certificate program for those who maybe want to go the faculty route and those who are more interested in just in learning some of the skills and ideas behind being a good teacher. Because we know as pharmacists, we're going to be teaching, whether that's formal, right? Or whether it's teaching patients how to use medications. The skills that you need to be a good teacher can be applied to many aspects of the pharmacy profession. So we also have enrolled new faculty in the teaching certificate program. And of course, we have faculty mentors. So if you are in the teaching certificate program, you will be paired with a faculty member here in the department who will work with you as you go through the program and be, a guide and a mentor to you. And this is available to all of our School of Pharmacy and University of Maryland residents and fellows, and to residents in the greater Baltimore area. And really, again, it is the focus of the teaching certificate program. The full program really is for those who are interested in that faculty track or who think they might be interested in the faculty track or in academia. So one thing that's come up in the past is I've had residents say to me, well, my RPD told me I had to complete the teaching certificate program. So I want to let you know, to empower you that this should not be a requirement of anyone's residency program. This is our University of Maryland program. So not that I'm asking you to telling you to argue with your RPD, but this should not be a mandatory requirement. This should be something that you choose to do. Our faculty put a lot of time and effort into the program. And so we expect that if you commit to the program, you're committing for the full year. All right, so what is involved in completing the teaching certificate program? The first thing is that you will take the educational theory and practice course. You don't have to officially register for this course. You don't have to pay for this course, except that you're going to be paying us in teaching hours, which I'll get to a little bit later. This is a 13-week course. It is a hybrid course. And by hybrid, I mean that a lot of the materials will be online on Blackboard. There'll be readings, there'll be textbooks. I have some presentations for you, but you will also, I'm really hoping this year, for those who are in the course, that instead of everything being online and asynchronous and doing online discussion boards, which really aren't discussions at all, that maybe we can start to bring it back and have some of those discussions in person, or at least, live virtual. And then that's maybe a little bit less work for you in terms of writing, maybe a little bit more interesting for all of us, because we can really discuss some of these theories and these issues in education, rather than just, a series of writing assignments. So again, it's 13 weeks from August to November. It doesn't follow the normal fall semester schedule because it's not offered to students, so I can offer the course whenever I want. And the reason that I do it at this time is because in August, you guys are not as busy as you will be. You may find that hard to believe, but it's true. And also, it will give you this knowledge and skills related to teaching, presenting some of these experiences, designing educational activities, maybe before you're actually asked to do that, for the school, or to do your CE for your practice site. So hopefully you can get some of this training in before you're asked to do all those things. All right, so let me see how to do this. I might need to go back here. I tried to do something fancy. We'll see if it works. Okay, so the first one is pharmacotherapy rounds. I'm not going to talk about that at all because Dr. Travato just gave you all the information about that. Pharmacotherapy rounds is a part of that, but if your institution does not participate in pharmacotherapy rounds, either here or at Hopkins, it's okay to substitute a CE program at your practice site. And we've had residents do that before. The main thing here is that it should be a CE activity. That's a very high level presentation that you're developing for other professionals. That's the point of this specific activity. Okay, then we have an additional lecture. And ideally, this will be another lecture or large group teaching activity that's for a different audience. Because when you think about developing a presentation, you have to think about your audience, right? And if you're giving, even if you're giving a presentation on the same topic to a first or second year pharmacy student group, you're going to do that a lot differently than if you're giving a presentation to pharmacists or even to your co-residents, right? You're going to be teaching it at a different level. And so it's good practice to develop presentations for different audiences. Sometimes that's not possible. It depends on the opportunities that are available, either here at the school or at your practice site. But if possible, it's great to do 2 different types of presentations. Or if you do any community engagement, develop a presentation for a community audience, that's a great experience as well. The third activity is a small group teaching activity. So lectures are large groups, even if they're not super large, you're developing them as though they are a large group, and so small group activities, you're able to do more small group discussions, case presentations, different kinds of active learning than you can do when you're trying to engage a large group. So that's why we want you to develop a small group learning activity. And this could be, again, if there's something available at the school, that's great. A lot of times for our abilities lab courses, you can develop, or even for the therapeutics courses, you'll be asked to develop, case style discussions. But you can also do these in residency, because as I recall, every single rotation I had in residency, I had to do a case presentation and discussion, right? So you're going to be doing a lot of those. I think the key here with any of these, even if you're using activities at your practice site, to get evaluations. It can be very easy in the course of your rotations and your residency to just kind of do things and get them done and check the box. But if you have, if you're able to bring evaluation forms, get feedback, it will be a much more meaningful experience for you having done, the activity. When you're doing activities here, the faculty should be filling out evaluations for you as well. And those all go in your portfolio. Yes. Oh, that would be probably online. I didn't hear it, but can we mute? Can everybody, if anyone's listening online, can you make sure that you are muted? Oh, is it? Okay. Everybody make sure your mic is off. I didn't actually hear that, but thanks for mentioning that. So the final thing is precepting a PharmD student. Now, this is an entirely different kind of teaching, right? Precepting is different from classroom teaching. And you'll use different skills when you engage one-on-one with a student. And this is where you really start to bring in your own experiences as a PharmD student, as a resident, with the preceptors you've had that you really got along well with, maybe some that you didn't, and you bring all those experiences together, as you precept students of your own. Now, the best way to do this, again, it really depends on how many students you have at your site, if what rotation you're in, and where the students are. But if you can have a kind of a longitudinal experience with that student over several weeks, that is the best way to accomplish this. And I will also say that it's great if you can have two evaluations of your own precepting. One is you can have your preceptor evaluate your precepting, okay? And the other is if you can ask the student to evaluate you as well. So you're kind of getting feedback from kind of both ends of the precepting experience. All right. Other requirements of this program: when you are assigned your faculty mentor, you should reach out to the faculty mentor. It's great to have a meeting, in August, just so that you can get to know each other. What are your goals? If you decide to do the teaching certificate program, really think about what you want to get out of it. What are your goals for completing this program? How is it going to help you in your career as a clinical pharmacist? So sit down with your faculty member in August if you can, but you at least have to meet with them twice, in December and in May or June, whenever you're done, so that they can complete the progress report, kind of at the midpoint and the final. And you will also serve as a facilitator or teaching assistant in PharmD courses for at least 12 hours. Now, if you guys are University of Maryland residents, you may have teaching hour requirements that are higher than this. And this would be included in those 20 or 40 hours or whatever is required by your program. But if you are coming from another residency program and just doing the teaching certificate program here with us, then you have to, kind of, I said, the payment for the course and the program is the teaching hours. So that's 12 hours a semester. And it doesn't include any of the lectures or case, small group teaching activities that you develop. Those are separate. What I'm talking about in terms of facilitating is, we need 4 people in lab to evaluate how well students do blood pressure, or we need, 4 residents to act as, to evaluate patient counseling activities. Those are the kind of things that we need residents to assist us with in the PharmD program. What do you get other than a really intense sense of pride and accomplishment in what you've done? You get a teaching certificate that you can print and frame and hang in your office. And this past year, we have also started giving out digital badges, which are a little bit new to me, but they are credentials that you can link to from your LinkedIn, for instance, that, people who are going on your LinkedIn or your online portfolio or whatever you use can see that you have accomplished this and what skills are associated with completing the teaching certificate program. So if you are not interested in the academia pathway, but you're still interested in learning about learning and teaching and maybe developing some of these skills, you can take the educational theory and practice course just by itself. Without, if you do that, you're not going to be paired with a faculty mentor. You don't have to do the precepting and the lecture and the small group activity and things like that. You may have to do a CE program as part of your residency, but that would be separate. This is just the course. And the course covers a lot of the knowledge and the skills related to teaching. So you'll be giving a presentation, you'll do an instructional design project where you learn about the systematic process of developing instructional materials. This is very close to my heart because I have a master's in instructional systems development. So I'm a little bit biased. I think it's very important. Again, we have some great discussions about issues in teaching. So you can do that alone, and that'll cost you 8 hours of teaching a semester in both the fall and spring semesters. So what is the role of the faculty mentor? Just to kind of set your expectations, the role of the mentor is, again, they should meet with you at least twice, but more is fine. Ideally, you develop a relationship with your faculty mentor where if you are doing a teaching activity, you can talk with them about it, submit drafts. Now, of course, not all faculty mentors are going to be expert in the things that you are presenting on. I have had residents who've done their pharmacotherapy rounds on, critical care issues, which, is very outside my comfort zone. I can't be a content expert, but I can look at your presentation. I can see whether there's a logical flow. I can evaluate your instructional objectives. So we can talk about those things. And I encourage you to develop that relationship with your mentor. They should be able to they will be providing feedback on your instructional design project and teaching philosophy, which you'll complete as part of the educational theory and practice course. And then they'll complete your progress reports so that you can actually complete the program and get those awesome certificates and badges. Any questions about the teaching certificate program or the educational theory and practice course? Cool. The next part of this presentation is just to give you an overview of our Doctor of Pharmacy program and how you sign up for teaching opportunities. So I mentioned that if you are an SOP resident or fellow, you will have an assigned number of hours. Other than that, if you decide to participate in the teaching certificate program or the educational theory and practice course, you'll also be responsible for signing up for 8 or 12 hours each semester of teaching assistance. Okay, so this is the overview of our curriculum. One of the hallmarks, the things that we've really tried to inject into the PharmD curriculum here at the School of Pharmacy is the ability for students to really individualize their education here. We have a very strong science foundation, a strong therapeutics course, and a series of abilities labs throughout the first through third years. So our abilities labs are courses that students take one in each semester in the first through third years that complement the therapeutics that they're learning, and they can learn different skills needed not just for different aspects of pharmacy practice, things like community pharmacy, hospital pharmacy, making IVs, but also professional practice. And these are where they can really practice these skills. Okay. We also have our therapeutics courses, which are really the first and the second year, and are module based with different topics. And we do attempt to sort of line up the topics in therapeutics with the topics in the abilities labs. We also, in the spirit of kind of individualizing students, the student experience, students can participate in pathways. And pathways are a way for students to choose their elective courses to get, a specific recognition in a topic area. So we have the geriatrics and palliative care, pharmacotherapy, pharmapreneurship, which is the pharmapreneurship is our school's focus on creative endeavors in the pharmacy profession, which is so important, and the research pathway. And in both the pharmapreneurship pathway and the research pathway, students get really individualized attention from faculty members on special projects or research projects to prepare them for either entrepreneurial endeavors after graduation, or if they want to go into research or further education by getting a PhD. We also offer a number of dual degrees to our students, the JD, a couple of different MBA opportunities, several of our master's and PhD programs here at the School of Pharmacy, including the Medical Cannabis Science and Therapeutics, for which I am the program co-director. So if you have any questions about that, please let me know. Some of the activities that we are looking for volunteers for in Abilities Lab, as I said, these would be things like evaluating the students or teaching the students how to perform different types of physical exam, how to take blood pressure, different activities related to patient counseling, creating IVs, drug information, MTM. These are all the skills that we need. And we need a lot of residents because we try to make our resident to student ratio as small as possible. It's better for them and it's more interesting for you. Our didactic courses also need residents to assist with things like grading assignments, leading review sessions, helping with case studies and team-based learning sessions, or facilitating office hours. These are some of the things that you might be asked to do. So I apologize, there's a lot of text on this slide as I see it now. So this is the actual process. So what we are doing right now, Daniel Costa and Daniel, have you introduced yourselves to them yet? Okay, you want to take a minute and do that?
Thank you. Thank you, Dr. Sera. I'm Daniel Costa. I will be working with a lot of you on this process, also pharmacotherapy rounds, the TCP teaching assignment. So the process of teaching assignments, some of you will be assigned to assist with an entire course, and some of you I will send out a sign-up sheet in which you will be everything we have collected from course managers and the help they need will be listed there, and you'll be able to choose which is best for your schedule. And then you will then be in contact with the course manager on how to facilitate that teaching.
Thank you. That's yeah, and that is about it. I probably could have done with a lot less text on that slide.
Oh, you did great.
Okay. So we are working on collecting opportunities and requests from faculty now, so that we can put those together and send out the sheet to you, and you can take a look and see, one, what's interesting to you, two, what fits with your schedule. Hopefully there's enough opportunities where both those things happen to fulfill your training requirement. And we will be in touch with those. So when you sign up for a teaching activity, you should contact the faculty member who is in charge of that teaching activity at least a couple weeks ahead of time to find out what's expected of you. Often there's some kind of orientation prior to the activity, so that you understand what you are supposed to be doing. So it's up to you to contact them, to bring an evaluation form with you to the activity itself so that they can fill it out. And I do advise that you actually bring the evaluation form with you on the day that you're teaching and ask the faculty member to do it then. just because then you know you will get it back. And sometimes as things go on, it gets harder and harder to catch back up, and you're playing email tag and, so I would say bring it with you. Your responsibilities as a teaching assistant or facilitator, and this is whether or not whether you're doing an activity for the teaching certificate program, like you have signed up to give a lecture, or to develop a case. It's up to you to find out what the deadlines are, from your preceptor. Make sure that you guys have, managed your expectations, what the faculty members' expectations are, so that you can meet those deadlines. Show up on time and prepared for your teaching activities. Make sure that your RPD knows what your teaching schedule is, so that everyone is on the same page with what your responsibilities are to the school. And if something comes up, okay, that you are unable to meet your commitment to teaching, it's up to you to find coverage. And we're going to make available, I think, to everyone who's teaching, a contact list, so that you are able to reach out to other residents to cover your responsibilities if something comes up and you can't make it. And I just want to say that we really need the resident help for the student to make this curriculum work. We need the resident help. These activities are not developed for your benefit. Okay, you do benefit from them because you get to develop teaching activities and you get experience working with students, but they're not for you. They're for the students, and we need you guys to help out. So just to kind of remember that the end goal is to make this a good experience for the students. Final thoughts: if you decide you want to participate in the teaching certificate program, you need to know pretty soon, right? So we need to identify and assign faculty preceptors. That means I need to know if you guys, now that I've given you this presentation, if you guys are all just super interested in the program, we may need to knock on some faculty doors and get more people to sign up as mentors. And then the educational theory and practice course, as I said, starts in the second week in August. So it's coming up pretty quick. So think about it, talk to your RPD, and then let us know as soon as you can. That's all I got. Any other questions about this process? Yes.
I may have missed it, but can you reiterate, you said it was 13 weeks. What is like the distribution of time within those 13 weeks for the course?
So I would expect to spend, I think on average, you would spend about maybe 5 hours a week. Now, as I said, on course activities over that 13 weeks. Now, it's not all, the weeks don't have all the same amount of activities or the same types of activities in them. And as I said, I'm trying this year to move away from asynchronous online discussion boards where you're writing and move toward more informal, but maybe more interesting group discussions, which may kind of reduce, for you, the amount of time that you're spending on things like writing activities for the course. But I would anticipate on average about 5 hours a week for activities related to the educational theory and practice course from August to about the middle of November.
Great presentation, Dr. Sera. I just wanted to give a quick note about the TCP. Today, I will be sending out an email to all of you asking for anyone